The thing that inspires me is that we've got an opportunity to change what's going on at the moment. And
I think historically, we waited for people to fall off the cliff, and wherever they landed, be it an acute hospital bed or being ill in the community, I think now we've got a much better idea about planning, about looking at needs in terms of demographics, in terms of the prevalence of various conditions, and building our services around that in a way that has the services in place before the crisis happens.
I think they have a great vision, particularly with their Better Together programme. I think they're doing amazing things.
Our CCG is very locality focused. They have a good clinical base. They're moving forward with good, sensible, sustainable plans.
I know as a CCG we're very well thought of already, and I'd like to think that we're one of the best in the country. And that comes down to the programmes we're putting in place to improve patient care. I think I now see things from a much bigger perspective. It's very easy to see things from a very small perspective when you're working within practice and you only see what happens in your room and in your building. But having the links with the CCG makes you see what the much bigger picture is, what's happening in a local area, what's happening in the wider area, what's happening nationally. It allows one to see and appreciate all the things that are going on to help support us looking after our patients.
There's lots of great examples. Part of our work with engagement has been around the work we've done with the quality delivery system.
We have really good plans in place of how we are going to deal with patients with long-term conditions to manage as many people as possible in the community.
Working with travellers' communities has been a really positive piece of work, both engaging with the traveller community but also raising awareness of health service providers as to the needs of travellers and the way they access services and what the challenges are for that group.
I've changed my practice because of the PRISM programme and because of the ear care training. I'm trying to approach patients in a different way now, in a much more patient-centred way.
The CCG very much took the initiative to develop the PRISM programme. We did a lot of consultation, we did a lot of work to engage people in it so that they were also committed to it, and it's been pretty successful.
I think being involved with the work streams has been really important and has had a positive impact, and I think going forward will continue to have a positive impact.
I think now we are really feeling that we have got a plan for the next 5 years and that this plan fits very well with direction of travel that is expected of us with integration of health and social care, and that we are setting ourselves up to be able to deliver a really good healthcare system.
Key benefits of a CCG for me are it's local people making local decisions, hopefully about their own community that they live and work in. I found working with the team to be really friendly, fascinating experience. It's taken my pharmacy role into different areas.
They are supportive, they listen to what we need, they act on it as well, they don't just listen, and they come to us for advice.
They're very open-minded, they're appreciative of other organisations, they respect and listen to others.
Everybody is approachable from top to bottom.
They're very keen to have clinicians on board with the CCG, and they've actually taught me quite a lot about commissioning.
Having these direct links with the CCG makes us feel like we're all in it together and we're working as one whole body rather than a them and us attitude.
I feel we now have a very strong team in the CCG which are going to be able to deliver in all areas.
I think it's very important to expand these links that we have.
Going forward we can work together and integrate services. I know the PRISM is a really good example of integrated services, so I'd see that sort of model in other areas.
Well, I think we've got opportunities to grow our relationships with the voluntary and community sector, because the voluntary sector's got a lot to contribute in helping us to transform the services along the lines that we plan over the next 10 years.
Being involved in the CCG means that we can look at things for the future, we can look at plans to keep patients at home when they don't need to go to hospital, we can provide extra services if needed, and we can have some excellent team working.
The NHS makes me proud. I'm very passionate about it, and I still think it's the best thing that this country's got, and me personally, it's something that I will always fight and strive for.
I think the commitment to provide good patient care is what comes across so clearly. Yes, money is important, but you can see quite clearly from being involved with them that it's not about money, it's about providing the best possible patient care that we can. And it's so heartwarming and inspiring to see that that comes right from the top.
I think other people are learning from our example, and I think that's something we should feel very, very proud about.